guys, welcome back to my channel. And for today's video, I will be doing a video on my 4th year in nursing school, right? So this video is going to be kind of a little bit boring, but for the persons who are really interested, stay tuned for the rest of the video. Please ensure that you hit that subscribe button. We provide nursing videos over here, lifestyle videos, and any other video that I think of doing. Yes, I don't want it to be a nursing only channel because of course I do other stuff in my life. I'm not only a nurse. So my 4th year in nursing school, it was one of the most hectic years. It was one of the years where I felt like boycotting nursing, if you know what I mean. It was very rough, and my friends that you see in my vlogs, they had to be pushing me. They had to be saying, Brit, you didn't come so far to drop out. No, like continue, just keep doing your best. And they kept on encouraging me. So in your 4th year, you really need some persons behind you to help you and to encourage you to continue going and to go to the finish line. 4th year, that is where you will start to say, why am I doing this? Right? So we're just gonna go right into the courses. And for 4th year, I don't think we did much courses, but we were mostly in the hospitals doing internship, so that's why we didn't do much, right? So we're gonna start with our first semester. First subject that I see a grade for is nursing care of children and adolescents. So for this course, it basically talks about the growth of children and adolescents and how you would deal with them, diseases that are common to that age group, and how you deal with them psychologically, how they develop psychologically as well. And it's very interactive. It's a very good course. I think with this course we went to the schools and we did like teaching sessions with them. We did teaching plans, so we learned how to do lesson plans. So it was a really interesting course, and I got an A in this course. I think that I garnered a lot of information as it relates to the breakdown of the course. I don't quite remember what we did exactly, but yes, for the theory part of it, it was fully exam. So 40% multiple choice, then a 60% final. So that's the breakdown of the exam. And as I said before, it talks about the lifespan, psychologically dealing with children and so forth. So for the practicum, we went on the pediatric ward. We dealt with the children, we cared for them. It was a really rough practicum, to be honest. The nurses there were not nice. Yeah, I didn't like the practicum part of it, but I did well. But yeah, and the third and final course that we did in the first semester of 4th year was research project. And this is why I understand why we did 3 courses. So research project, I dreaded the course because remember in my 3rd year, if you watch my 3rd year video, and if you haven't, go over there and watch my 3rd year video. So in my 3rd year, I got a C for research. I almost failed the course. I think I got 51% and the pass mark is 50. So you know, so I was really pushing it. So for research, I was really dreading it. However, we got paired in groups and we got to work on the project with another person. So the other person that was working with me was stronger at research, so she pulled me doing the research project with her. So we did very well on our presentation. We did well on the document itself. So we got a B, and I was so grateful for the B because I didn't expect a B. I literally cried when we got our grade. In 2nd semester, we did nursing care of patients in specialized care settings. Now, specialized people, specialized was my course. If you know about specialized care settings, you know, say ICU, accident and emergency unit. Sometimes they would say operating theater and the recovery room. Those are the 4 places that you go when you talk about specialized nursing care, right? I really like this course. I don't know if I'm gonna end up in the ICU, A&E, or any one of them, but I like specialized nursing. The drama of it is what got me going. That really got me going. So I really like specialized, and I got a B in that course. I think that was the theory part of it, so you get your multiple choice right through. So for the practicum now, we did ours at the hospital. We got a sheet where we should sign off on some skills. I did every single one of them that I was supposed to do. So we're supposed to do venipuncture, we're supposed to do CPR, or even be a part of it. Like, that was really exciting. I did it in A&E one day when we went there. We were in A&E for a portion of the training. We were in ICU, we went to the recovery room, we went to the operating theater, we got our skills signed off, and it was so good. The highlight of the practicum was actually the exam itself, because it's after the exam I realized that I know, and I know a lot, but I doubt myself a lot. That's my problem. That's my biggest issue. And the thing about me, I'm too much of a perfectionist. Like, if I see that I get one thing wrong, me discard the whole exam. Like, me say I fail. And people in my class will tell you, I'm not done, but me doubt myself a lot. Everybody always say, I always cry when I exam time, because I say I go fail, because I don't feel like I'm ready. But at the end of the day, when I'm going to the exam, I show the exam. Like, oh. But in specialized exam, we got a scenario, and we were supposed to tell the whole management, from nursing right down to medical management, right down to the medication and everything. I think I got increased intracranial pressure, and we're to tell what to do in an emergency setting. People, I remember a few things. I'm not gonna tell a lie. I remember a few things, but all I know, I did very well on the exam. And even while I was doing my exam, the persons that were marking me were smiling. I was like, why are they smiling? But anyways, people, I got an A in specialized practicum, and I know I deserve my A because I worked hard for it. People, for specialized, even in the pandemic, when they told us that we weren't going to graduate on time, I still was studying specialized. Like, for a good month, I put down my book, but specialized, I did the first course me take up the book back for. So I really had a love for specialized. So yeah. So the next course is leadership and management in nursing. So this was a full multiple choice course. So it talks about different leadership styles. It talks about basically the skill mix of nursing. So you have your nurses with different range of experience. You have your PCAs, you have your unlicensed personnel working in the hospital. You know what to give them to do and what not to give them to do. You know, like different assignments that the more experienced nurse should get, as opposed to the junior nurse that just came onto the ward. So those are the things that you learn in leadership. And leadership was a very good course, but it's very boring. You have a lot of reading to do, and sometimes you cannot put things together because this is not a part of what you've been learning all along in nursing school, if you know what I mean. Like, psychology just come in and just did it so? Yeah. But after all, I connected to the dots when I went on the ward to actually work as an RN. So when I went to work as an RN, things weren't foreign to me, so I understood why I actually learned it, right? So I understood more, and I would contribute to having a smoother flow of duties that I do on the ward and what happens on the ward, basically, because you have to understand what happens. So the next course that I did, oh, by the way, I got a B for leadership and management in nursing. I was 2% away from the A, but that's fine. So for the practicum now, it was a simulation, presentation, and all the works, and I got an A in that. So we did an in-course test for it. I got almost perfect score. For the group work, I got a very good mark. And I think there was a portfolio to do. So all of those grades were put together and we got a grade for it. So the third and final semester in nursing school is where everything starts to boil down. We're mostly at the hospital and we have these 2 last courses to complete. So the first course that we had was clinical internship. So you basically they go to the hospital every day for a whole month. Like you live, breathe, work, sleep, hospital. You have no exams to do, but it's just hospital, hospital, hospital. So for clinical internship, you get 3 different assessments where it prepares you for your R&R span of duty exam, and I spoke about that exam already, so I'm going to put the card right here so you can go ahead and watch that video to know what to expect for your span of duty examination. Next, I am going to do R&R, so stay tuned for that video. All right, so for clinical internship, after my first assessment, I wasn't sure if I was going to be recommended to do span, because of course they say I have to be recommended to do span. So she worked with me. I sent her care plans daily. She corrected them and I started to implement it, because at one point, trust me guys, you see, when I found out that I wouldn't be graduating on time in 2020, that is what got me down. I graduated in January of 2021 and that slowed me down. So after I did the 3 assessments, I found out that okay, I can do this. I probably can. Yeah, so for clinical internship, I really enjoyed doing it. However, it's very hard to stay on track or stay on the right path to be recommended to the span of duty, because if they say that you cannot manage, they won't recommend you, right? So for the next course is the next course is Senior Nursing Review. So when we got this course, we were kind of like, where this course come from? Like haphazardly just jump and we start like, I don't understand. But you have to pass everything before in order to be recommended to do this course. So everything I have to recommend before you do something else. So for Senior Nursing Review, you basically go over care plans, patient scenarios, you go over every single thing. Then you get 3 assessments. We went online to do it because of COVID and everything, and we were combined with Mona, so it was like more of a holistic approach, because what Mona knew, they shared with us, and what we knew, we shared with them. And some things that we had in our mind, Mona didn't have in theirs, and some things that Mona learned, we never learned. But it's okay, because you know, yeah, we're bright same way. So after we did the 3 assessments, you would get your degree when you pass and everything. So you basically have to do the course. There's no if or but, and if you fail one assessment, you cannot move on, basically. So I passed all 3, because right then and there, I think you get a grade on our review and they show you how much you get out of the 100%. So I knew I passed all 3. Ready to get my degree now with everybody else. Everybody else get their degree now. Me forget my degree. Somebody go call me and ask me where my 3 grade them there. So when we go up on our review, me don't see the grade them again. All of a sudden the grade them gone. So me I say, what really I going? Me not get my degree today. Anyways, the issue was I have to get my degree in order to book to do my graduation picture. Mark you, graduation picture was like the Friday, and at the Wednesday or Thursday we forget the degree. Them can't find my grade them. So the lady said if I had my receipts that I actually did the test on in my UE email. So I say yes, I have the receipt. So she says hurry up and send it to the lady in Kingston before she leaves. I hurry up and send her. When I go up and sass and look, people, me get my degree because my past Senior Nursing Review. And people, let me tell you, you see me see the P come up, I'm a come out, I'm gonna go check my degree or my transcript. Goody have second upper class honors. People, if you all were following the nursing review or the nursing series, you would have known say girl I come from on 2.4 or a 2.4 one 2 point something GPA, and I finished nursing school at 3.24 GPA. I'm well proud of my GPA because a couple see me absorbing a year 1, because year 1 for me was rough. A couple C me capture in a year 2. No, I'm not get no C in a year 2. I get 1 more C later on down, but it was hard to keep a balance with everything. So I was very proud of myself, knowing where I started and where I ended on a high note. I realized that I'm easy to refocus. I'm easy to get back on track. And you see, until you find how to study for your exams, and I did a video on how to study for your nursing exams, until you find the formula, you will always get some low grades. So you need to find out or figure out how you study best and work at it. So this is the end of the video. Please stay tuned for more videos. Ensure that you hit the subscribe button down below if you enjoyed this video and if you got some good tips and tricks on how to pass the courses. For most of the courses, I use the lectures notes and the Nclex Nursing Review by Saunders. And for Senior Nursing Review, they actually give you practice questions for RE&R, the theory part of it. So pay close attention to those questions. For most of your courses, it's all goes into preparation for your RE&R. So if you haven't been doing well, or if you have been getting 70s or low 60s or whatever, you need to focus more on doing practice questions from the Saunders book and try sourcing like questions similar to the style of Nclex, because most Nclex questions are similar to the questions that we do here, because most of the times RE&R is trying to mimic Nclex, which is understandable because nursing is universal. But anyways, people, ensure that you stay motivated. Ensure that you continue strong. You start off strong and you finish strong. If you're in third year, fourth year, any year at all, shoot me a comment in the comment section, because I love for solo. And the people that I saw on the word, big up on yourself, and for the nurses that I taught something, make sure say it stick with you and it don't leave you. Period. And for the nurses that did examine my word, big up yourself and congrats. I know that you all passed. Yeah, girl, I do. So thank you so much for watching. Bye.